I stopped getting out of bed in the morning. There's definitely times when I just had this unexplainable depression. It was the worst hell I could possibly imagine.
It would be easy to think of substance abuse as a personal failing, a lack of willpower or moral character. But at INSynergy, an innovative St. Louis-based substance abuse program, they believe addiction is often rooted in medical problems that require personalized medical solutions. And the tool they use to reveal those sometimes invisible medical conditions is genetic testing.
Well, I like to think that we're always kind of ahead of the curve. About 7 years ago when we started looking at genetics, I would look at only 3 signals. Now we're looking at 24. If you just detox and put them on anti-craving medications, you're only kind of scratching the surface.
It made so much sense. It was incredible.
In Tom's case, INSynergy's genetic testing revealed his alcoholism was rooted in an undiagnosed attention deficit disorder that, with treatment, helped him finally achieve sobriety.
And as I was treated for it, the desire to have anything to drink or anything to kind of bring my speedy brain down to a normal speed vanished.
A much more common discovery found through INSynergy's genetic testing is a specific enzyme deficiency that affects the body's ability to break down folic acid. Put simply, too little of the enzyme MTHFR can lead to anxiety and depression, which often trigger substance abuse.
What we have found is about 80 to 85% of our patient population have this genetic abnormality. And as soon as we recognize it, we treat it with L-methylfolate.
The prescription version of L-methylfolate is called Depplin, a once-a-day supplement which has helped patients like Will, who began drinking and using drugs as a teenager. 4 other treatment programs missed the genetic connection between Will's addiction and his MTHFR deficiency. INSynergy's testing discovered it immediately, and they prescribed Depplin, giving Will the tool he needed to help him get sober.
Within a couple of days, I noticed a significant difference.
How did this factor into your recovery?
With Depplin, it makes me feel like I can live completely free of any other substances and feel great and think effectively and sleep effectively. Now, every morning that I get up, it's the same feeling. It's the way you greet your day.
Whether it's MTHFR, ADHD, or a different medical condition, once INSynergy's testing reveals the underlying physical causes of addiction, talk therapy and family therapy are used to enhance recovery.
Keeping the patient on the least amount of medication that gets them the most stable is a philosophy that we really pride ourselves on in getting the patient well.
It's such a different approach that INSynergy has. It suggests that the rest of their recovery program is going to be a little bit more holistic also. I don't feel anything but clarity and happiness.
For more information about INSynergy, including a no-obligation free individual assessment, go to INSynergySTL.com. Reporting for INSynergy, I'm Paul Shankman, StorySmart Video News.